Well, the city of Baltimore will also soon have a new health commissioner. Mayor Brandon Scott made the announcement today. Dr. Michelle Taylor will begin this summer. She is a pediatrician who also has a degree in public health from Johns Hopkins. And Dr. Taylor joins us now live. So good to see you, Dr. Taylor. I guess I should say welcome back to Baltimore.
Thank you so much. Wonderful to be here.
Well, wonderful to have you. So you're coming from Shelby County, Tennessee, which I understand is about 3 hours west of Nashville. Now that area, about half the size of the city, but it has similar health concerns as Baltimore. Among them, I've seen you mention addiction, poverty, in need of better access to good health care. So how will you take what you have learned in Shelby and apply it here in Baltimore?
Absolutely. So good to be here. And I will tell you that really, at the end of the day, most populations, and I can say this about Baltimore just like I would say it about Memphis and Shelby County, want to feel seen, heard, and want to have the best tools available to promote and protect their health. And so coming in as a new commissioner, I know that I have to listen not only to my team at the Baltimore City Health Department, but to all the people in all of the communities in Baltimore City to really find out what their concerns are, what their pressing needs are, and then to make sure that we're translating that into the best possible services to help people to promote and protect their health.
How are you going to do that? How are you going to hear from people?
Well, I mean, it takes a lot, right? So especially a lot of people talk about a 30, 60, 90-day plan. And I am really a hands-on health director here in Memphis and Shelby County. So even tomorrow, we have what's called a community care fair where we go out and we take every service possible that can be moved from our headquarters to the neighborhood, to people, and take it to where they are so that it can all not only be convenient, but accessible. And I believe that this is a model that can also work in Baltimore. Baltimore has a lot of similarities to Memphis. Like you said, the population in Baltimore may be a little bit larger when you talk about the surrounding area, but the makeup of the people is very much the same, and the resilience of the people is very much the same. So I'm looking forward to meeting as many people as I can and really getting in, listening to the team, listening to the community, and making sure that we're doing everything possible to help make Baltimoreans healthier.
Well, let's be practical here for a second. 30% of the health department is reliant on federal grants, and I probably don't need to remind you about the threat of federal money being taken away. How will you deal with that challenge?
Absolutely. So unfortunately, public health through the years has gotten used to doing more with less. Of course, that's not the situation that we want to be in, and we will do everything possible to not be in that situation. But what I can tell you is that just like in Memphis, Shelby County, I know that the people who work at Baltimore City Health Department do not get into the business to make money. They get into the business because they love public health and they love serving people. And so we're going to do just that. You have to make sure, like I said, that people are feeling seen and heard, and that you are providing those services that are vital to the community. And so if we're not getting those monies from the federal government, there are other avenues. There's philanthropy. There are private foundations who are looking to help, especially in this political environment. So I'm confident that working with academia, philanthropy, and other private foundations, we'll be able to make up some of those gaps and make sure that we are providing the services that people need.
All right. Well, I look forward to meeting you later this summer and to having you come to Baltimore. And I thank you for joining us, Dr. Taylor.
Absolutely. Thank you.
Thank you.